Hello guys, today we'll be talking about tetanus and we'll be talking about tetanus under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is tetanus? Tetanus is a serious, often fatal infectious disease that is characterized by muscle rigidity and spasms due to the release of a potent neurotoxin by the bacterium Clostridium tetani. Tetanus is also referred to as lockjaw due to the painful spasm experienced in the jaw muscles of affected individuals. Tetanus is not transmitted from person to person, but it occurs when bacterial spores enter into the body through wounds, burns, surgical injuries, etc. Once in the body, the bacterium Clostridium tetani releases a potent toxin, a neurotoxin, that affects the nervous system, leading to progressive muscle stiffness and spasm. Despite the availability of effective vaccine against tetanus, tetanus remains a global public health problem, especially in developing regions and countries where immunization programs are quite poor and wound management is ineffective. Neonatal tetanus is devastating in regions with poor birth delivery practices. Tetanus, the disease tetanus, is considered as having a short incubation period and a very high mortality rate when untreated. And as such, immunization and effective wound management are very efficacious preventive strategies against tetanus. Let's talk about the causative agents. The causative agent of tetanus is the Clostridium tetani. Clostridium tetani. Clostridium tetani is the causative agent of tetanus. Clostridium tetani is a gram-positive, rod-shaped, spore-forming, obligate anaerobic organism that is commonly found in contaminated soil, animal feces, dust, and contaminated surfaces. Clostridium tetani is gram-positive. That means that it takes up the primary stain, which is crystal violet, in a gram staining procedure, meaning it colors or appears purple under the microscope when viewed using the oil immersion lens of the microscope. Clostridium tetani is an obligate anaerobe. That means that it thrives in the absence of oxygen. Also, Clostridium tetani spores are drumstick-like in shape and tennis racket-like, something like this. They appear like this. Something like this. This is how they appear under the microscope. Drumstick like tennis, more like a tennis racket. The bacterium Clostridium tetani releases two toxins rather, and it is these toxins that it utilizes to carry out its pathogenesis. These toxins include tetanospasmin as well as tetanolysin. Tetanolysin is uh, a form of hemolysin, and it lyses red blood cells, as well as other cellular and subcellular membranes, such as platelets and lysosomes. Tetanolysin is also believed to contribute immensely to the cardiotoxicity that is experienced during tetanus infection. Tetanospasmin, on the other hand, is the major and the primary virulence factor that is utilized by Clostridium tetani to cause the clinical manifestations of tetanus, which include muscle rigidity and spasms. The bacteria Clostridium tetani usually localizes in the site of infection, but the toxins released, the tetanospasmin and the tetanolysin, spread systemically and affect the nervous system. Let's talk about the pathogenesis. The pathogenesis of tetanus begins when the bacterium Clostridium tetani penetrates into the body, right? And this Clostridium tetani usually enters through wounds, injuries, deep surgical wounds, as well as neonatal contamination of the umbilical cord during neonatal tetanus, in cases of neonatal tetanus. Once in the body, the spores of Clostridium tetani stay dormant in aerobic conditions. In aerobic conditions, they remain dormant. But when oxygen tension reduces, the spores of Clostridium tetani germinate into vegetative forms. This vegetative form of the Clostridium tetani releases the toxins, the tetanospasmin, and tetanolysin. Tetanospasmin is picked up by the peripheral nerves and then transported to the central nervous system, where in the central nervous system, tetanospasmin blocks the release of inhibitory neurotransmitters, especially and glycine and gamma aminobutyric acid, as popularly referred to as GABA. In the central nervous system, the tetanospasmin blocks the release of these inhibitory neurotransmitters, glycine and gamma aminobutyric acid. Because of the blockage of the release of these inhibitory neurotransmitters, the muscles continuously contract because stimulatory neurotransmitters are responsible for causing muscle contraction, while inhibitory neurotransmitters such as the glycine and gamma aminobutyric acid are responsible for relaxation of muscles. So when tetanospasmin causes the blockage of the release of these inhibitory neurotransmitters, it means that the muscles prolong, like they continuously contract without relaxing. And this is the major clinical manifestation of tetanus, which includes continuous muscle contraction leading to muscle rigidity and spasms. There are about four types of tetanus. We have the generalized tetanus, which is characterized by trismus and widespread spasms. There's the localized tetanus that causes muscle rigidity in the site of injury. Cephalic tetanus affects majorly the cranial nerves, and there's also neonatal tetanus, which occurs when the umbilical cord of neonates are contaminated by the bacterium Clostridium tetani. So this is basically about the pathogenesis.